Lens replacements in the eye are ordinarily made of a very long-lasting plastic called acrylic. They can last for many decades. Ordinarily, we say to people they last 50 years, which will outlast most of us. Sometimes other diseases occur within the eye. So there can be clouding of the capsule behind the lens implant, but changes in the lens in terms of prescription are very small. So these lenses are very stable ordinarily for the rest of your life. Lens replacement is a very safe procedure. The risks of taking your natural lens out of your eye and replacing with a plastic lens and losing your eyesight completely, in other words, going blind, is less than 1 in 15,000 to 18,000. So that's a very remote possibility. And we tend to acknowledge that and park that as a very small chance of happening. The risk of you being worse off, in other words, from the lens or the surgery, is less than 1 in 100 or 2 in 100. If that were to happen, then your vision would be blurred and not correctable with spectacles. The main risk that can happen with lens replacement surgery is that people don't always get the outcome in terms of the focus of the lens that they want. In other words, if you want a specific focus outcome, such as distance vision or near vision, there is a risk, perhaps 1 or 2%, that you may not achieve that. And that can happen no matter who does the surgery, no matter how good the lens preparation is in terms of preoperative eye measurements, calculations, and surgical procedure. Everybody needs to understand that the outcome can be very good in terms of the final focus, but it's not always 100%, probably about 98% on target. The answer is realistically no, it's not advised to do that. You can have your natural lens taken out of the eye, replaced with a plastic lens, and have it changed ordinarily within a few months of the first procedure, but there are risks associated with that, which include the risks of damaging the eye, but also of not achieving the final focus that you want. There are a lot of clinics around the country and around the world which will do lens exchange procedure and have a top-up procedure or a lens exchange or a laser top-up, sometimes approaching 5 to 10% of the surgeries that they do. In other clinics, such as our clinic, we try very hard to try and get the outcome right the first time round. So the number of patients who need something else doing is very low, perhaps less than 1 or 2%. The main types of lens replacement procedures fall into 2 groups. One is to replace the lens with single vision lenses, which generally correct your vision at one specific distance, and with multifocal lenses, which can correct your vision at different distances, such as having distance vision, intermediate vision, and close vision. Those are the main procedures that we do. The latest advancements in lens replacement procedures involve modification of the original lenses. In other words, changing the optical properties of the lens to give an increased depth of field, such that if you were to put a single vision lens in at distance, you may be able to get an extended depth, increasing your vision to closer ranges such as computer or near work. And certainly with the multifocal lenses as well, the lenses usually work at different distances, such as distance, middle, and near, and the extended depth version of those lenses tries to close those gaps between the focal distances.